Knee replacement surgery has come a long way over the years. Here to explain is orthopedic surgeon Dr. Fabio Orozco, joined by his surgical assistant George Reeves at Orozco Orthopedics. How has knee replacement surgery changed?
Thank you, Robin. There have been many changes in the last 10 years, especially in the last 5. From the medical perspective, patients are able to have surgery done in a surgical center and many times be able to go home the same day. We work really hard on hydrating these patients. They're able to take a Gatorade, water, drink their favorite drink on their way to the hospital the same day. And we start controlling pain before. So we're way more proactive instead of reactive. We also use different type of regional and local blocks around the knee that helps you to control pain and facilitates patient motion. From the surgical perspective, there are many changes, and one of them is not cutting the tendon, having less invasive approaches that promote early mobility. Also, the implants have changed significantly, and they are very low profile. This is basically the tibial component, which we will impact during surgery. The quality of this, which is the polyethylene, is tremendous, and we work with different ways to eliminate oxidation. So these knees can last way longer. If you eliminate oxidation, these implants can last many decades. This is the femoral component, and it also is a very low profile with minimal bone loss. And then that's what a knee replacement looks like. So basically, we're doing more a knee resurfacing than anything else. You still keep your ligaments. And without cutting the tendon, it really promotes a faster recovery. One more thing that's very important is that nowadays we can use technology where we don't have to use cement. And this is manufactured similar to the moon. So there is these porosities where the bone grows into it. It becomes part of your body.
Quick
so
recovery, lasts longer, and much better for the patient.
Absolutely.
All right. Thanks so much for joining us, Dr. Fabio Orozco. I'm Robin Stoloff, and you're living well.